Hi, I'm Patricia Wu, and I'm here at COP28 in Dubai. And joining me is Gareth Presch, the CEO and founder of the Rural Health Innovation Summit. Hi, Gareth. Thank you so much for stopping by.
No, it's a pleasure to talk to you, Patricia. What a fantastic event, COP28.
Yeah, and these surroundings, you really can't beat it.
You can't beat it, but also this huge opportunity, to align climate change with health. I mean, that's part of the reason why I've come here, is to show, that we need to make that transition to align climate finance with health finance. So that's a big opportunity.
Absolutely. I mean, the impact on our individual health, just from like respiratory diseases to countless other things, it's so critical. So tell us, what does the World Health Innovation Summit do?
Yeah. But just to touch on what you mentioned with the climate situation, millions of people die every year because of climate-related disease. So the respiratory diseases that you mentioned, it's a huge problem. World Health Innovation Summit is a platform. It's a preventative platform that looks after people's health and well-being. We're trying to give people the tools so that they can manage their health and well-being. As Simon Sinek always says, why? Well, the health system is under immense pressure. By 2030, we'll probably have between 10 and 18 million staff short globally. So the pandemic has really exposed the health system, its frailties. And if you look at the sort of waiting lists that we have now for elective surgery, 28 million globally. I'll give you an example. In the UK, you have about 7 million people waiting for surgery at the moment.
Wow.
So these are huge numbers. So what we're trying to do is work with government agencies around the world and create new models of healthcare focused on prevention. And you start with the kids. So we have our WIS Kids programs. Then we have WIS at Work, which is stress management in the workplace.
Much needed.
WIS Seniors, which looks after elderly, falls prevention, loneliness, quality of life. And then, of course, WIS Green, energy, waste, and water. Because if you don't have any water, you've got no health.
Right.
So it's kind of that holistic approach. I suppose for anyone tuning in, kind of in the States, think of it like a Facebook, only a health book. So that's what we're trying to create. And this basically is an economic model as well, because health is wealth.
It sure is. If you don't have health, you don't have anything else.
2.5 million people are sick in the UK at the moment. I'm just giving you some of the numbers. It's about 170 billion. It's about 7% of GDP. So this is a huge problem. So that's why we're here. We're here to work with governments, investors. We really want to bring, shall we say, a collaboration together to make sure we empower people to manage their own health and well-being, because the health system is under so much pressure. So we're trying to alleviate that pressure.
Right. Well, when you talk about GDP and the impact, I think you get the government's attention. And another thing is news that you're announcing.
Yes. Just here at the COP, we have a consortium of partners, the likes of the Global Social Prescribing Alliance. I'm the chief executive of the Global Social Alliance and Global Social Prescribing Alliance. And we're mobilizing pension funds within this health sector. So we have a donor advisory fund that we set up in the US, SEC regulated. And basically, we're now looking to work with governments, investors. And my job is to go and speak to the health sector's pension funds. And all we want is 1% of that pension fund to come into our DAF. And then we will deploy the capital into new models of healthcare. So anyone watching this, get in touch with me, particularly investors who are interested in impact. I mean, if you really want impact, go for health. We're very keen to work with people who are interested in meaningful impact. One of the benefits of this as well is to create millions of new jobs in the preventive space. And you can literally create a lot of new jobs. So this is also good for governments.
So what else are you hoping to accomplish? You already announced this big news at COP. Is there anything else you're hoping to accomplish?
Well, we've had so many, this has been a fantastic COP for us, because I arrived here. I'm part of Eco Green Capital as well, which is with the Great Green Wall of Africa. I'm doing some work around the Commonwealth as well. So, this has just been a fabulous time. The opportunity to speak to FinTech TV as well, I'm delighted. Today, I've got a panel discussion today as well, which is on Africa, healthcare and technologies. So the next week that we have left, I'm excited for it. I really want to focus on meeting those investors and then actually sitting down and working out how do we deploy capital into impactful projects that improve people's health and well-being. So that's, from my perspective, the key objective here, so that we can help those the most vulnerable in our society and ensure we leave no one behind. With the World Health Innovation Summit as this platform, what we can do is actually create models of care that improve people's health and well-being, create new meaningful jobs, strengthen health systems, and deliver the sustainable development goals.
Oh, well, that sounds wonderful. You'll have to keep us posted on all these projects.
Absolutely, absolutely. And, please do get it.
Thank you so much. And that was Gareth Presch, the CEO and founder of the World Health Innovation Summit.